Imagine telling a human patient to keep eating fast food every day and then giving them a GLP-1 like Ozempic to balance it out. That's exactly the direction we're headed with cats. And it should concern every veterinarian and every cat parent, because pharmaceutical companies are bringing these drugs to our pets. Before we rush to solve the epidemic of obesity and diabetes in cats, we need to address a truth that's rarely talked about. We are trying to medicate our way out of a nutrition problem that we ourselves created. A company in San Francisco is beginning clinical trials on the GLP-1 implant for cats. It's called the Meow-1 study. And the implant is designed to sit under the skin for 6 months and slowly release a weight loss drug versus having pet owners have to administer the injection weekly. Some are describing it as a potential blockbuster because more than half of the cats in this country are overweight or obese. But here's what gets lost in the conversation. Why are so many cats obese in the first place? And why are we acting as though medication is the only path forward? And what happens after the 6 months? Not to mention, these drugs are going to be likely very expensive. As a veterinarian who has spent decades treating feline obesity and diabetes, I can tell you this with absolute clarity. You cannot use medication to take away the consequences of feeding cats an inappropriate diet. You see, cats are obligate carnivores. They are built for a moisture-rich carnivore diet, one that is high in protein and has very little carbohydrate. Yet most cats today are fed dry kibble, a highly processed, carbohydrate-dense diet that does not match feline biology in any way. When you take a desert-adapted carnivore and feed them dehydrated, ultra-processed carbs, you create a perfect storm for metabolic disease. Obesity, insulin resistance, and diabetes, they become the predictable outcome of a species eating against its own evolution. Type 2 diabetes is at epidemic proportions in the human population, but it is also at epidemic levels in overweight and obese cats. So continuing to feed them the same species-inappropriate diet for 6 months and not changing the diet to a wet, minimally processed diet will lead to the weight returning quickly afterwards. GLP drugs may have a place in very specific medical situations. They can be helpful tools, but they are not a substitute for correcting the underlying diet. What troubles me most is the idea of continuing to feed cats dry food while turning around and prescribing GLP-1 drugs. You simply cannot medicate yourself out of a bad diet. We would never approach human metabolic disease this way. We do not tell people to keep eating nothing but ultra-processed food and rely on implants to manage the fallout. The same One Health principles apply to our pets. Diet is foundational regardless of species. If we truly want to help cats lose weight and prevent diabetes, the first and most powerful intervention is not medication, it's nutrition. A minimally processed, moisture-rich, species-appropriate diet supports stable blood sugar, a healthy body weight, better hydration, and metabolic balance. These are results I've seen consistently when cats transition off of kibble and onto food that actually aligns with their physiology. If your cat is overweight or pre-diabetic, start by looking at what's in the bowl. Move towards a diet that is moisture-rich, high in quality protein, low in carbohydrates, and minimally processed. This is the nutritional foundation that supports long-term health better than any implant or medication ever can. We can use GLP-1 drugs when they are truly needed, but they should never be the first line of defense when the real issue is the food our cats are eating. Changing what goes into the bowl changes everything: their metabolism, their hydration, their energy, and their long-term health. If you're looking for a simple way to move towards a fresher, less processed, more biologically appropriate diet, The Holistic Vet Blend Feline and Feline Senior Blends were designed for exactly that purpose. They allow you to feed your cat real food that you can make in less than 15 minutes. It's balanced correctly without relying on prescriptions to manage preventable problems. If you want to take that next step, I encourage you to take a look. It may be the most powerful wellness choice you make for your cat. Thanks for being here and for caring so deeply about your pet's health.